It's important to support children and young people with their mental health. With access to lots of children and young people, schools and colleges can play a vital role in this. When someone gets ill, it's good to provide support early before things get worse. This idea is just as true for mental as it is for physical health, and particularly true for young people, which is why the Trailblazer program funded 58 new mental health support teams across 25 areas, working with schools and colleges, parents and teachers to promote emotional well-being and help those with mild to moderate mental health difficulties get access to extra support whenever it is needed. Our job was to evaluate the first 58 teams in order to provide knowledge and insight as the program expanded to become over 400 teams, supporting over 3 million children and young people. We worked in partnership with young people to design our study and then carried out some parts of the research themselves. We also asked schools to fill out surveys and interviewed young people, school staff, and people working in the new mental health support teams about what helped the most and where the biggest challenges were. Our findings showed that all of the 25 areas made good progress getting the mental health support teams up and running before COVID-19 forced a bit of a rethink, with lots of support moving online. It was great that the teams could offer support even while the schools were closed, but not that great that some children, young people, or parents who couldn't get online or didn't want to talk about mental health issues remotely missed out. Schools and colleges really welcomed having teams available, and their staff told us they gained more knowledge and confidence in how to talk about mental health with the children and young people, and that they felt better connected to the mental health professionals in their area. Children and young people told us how important it was to have somebody at school who they could talk to, and that it was really good to know that their school cared about how they were feeling. We also found that the support on offer wasn't right for everyone, and staff in the teams let us know they would have liked more training on how to work with different groups of people and offer different kinds of care. Some children and young people who were really struggling needed more help than the teams could provide, and schools and colleges worried about how long it took for these children to get help from more specialist services and about those that couldn't find anywhere else to get help at all. Finally, we found that some of the people in the new teams left and got different jobs quite quickly after being trained, sometimes leaving them short-staffed. But challenges like these aren't always a bad thing, as each of them helped us to learn, to avoid mistakes in the future, and to strengthen the service as it rolls out to hundreds of new areas. Everyone that spoke to us and helped us gather information was truly invaluable, and we want to thank every one of you that got involved. We simply couldn't have done it without your help. If you are interested to see our final report, want to know more about what we did, or find out about what we are doing next, then please visit tinyurl.com/Trailblazer23.